Thanks for joining the People of Precision Health podcast, a series by Vibrant Health where we discuss the unique challenges of building human cohorts for health and clinical research. We talk with experts in population genomics and precision health to explore novel methods and real solutions for engaging the humans behind the data. Joining us today on the People of Precision Health podcast is Megan M. Ruxton, PhD, who joined Vibrant Health in early 2022 as our in-house survey methodologist. She aids our collaborators with questionnaire design, focusing on both content and technical requirements to provide the best possible participant experience for every study surveys. But before joining us at Vibrant, Megan was an independent consultant in program evaluation, where she used her survey methodology skills in tandem with her multi-method toolkit. Megan's prior academic experience as a political scientist informs her ability to leverage both quantitative and qualitative research methods and provides experience in a wealth of research topics, from environmental politics and policy to advancing diversity in STEM to supporting community substance abuse prevention. She lives in Indy with her husband and 2 corgis, where she spends her free time baking, running, and obsessing over true crime stories. Thank you and welcome, Megan. I'm so excited to have you on the podcast today. Megan Ruxton, PhD, our in-house survey methodologist here at Vibrant Health, who works with a lot of our collaborators. Megan, thank you for joining me. Should I call you Dr. Ruxton?
Oh, but please don't. It still confuses me to this day that I'm a doctor. So
Well,
Megan is
you worked
totally
hard.
fine.
You worked hard for those letters. Now, look, there's a lot of people out there who are building surveys every day. Data collection is a critical part of health research. But I think there may be a lot of confusion about your title. Your like, what is survey methodology?
Absolutely. So I confuse people all the time when I tell them what I do. My parents still have no idea what it is that I do. Um, and really, there is sort of a general understanding within survey methodology of what a survey methodologist is and what they do. And so, really, it's sort of you can think of it almost as cradle to grave of the survey process. They work right from the outset of when we know our research questions to figure out, okay, what's the best way to get the information that is needed to answer those questions? And so they work on questionnaire development, they work on format, they work on really just everything that goes into what a participant would see. In most situations, what you also see is that methodologists will actually be involved in the sampling technique used to get those answers, because typically they're working with projects that have a specific target population that you're not going to be able to actually target everyone. You have to be very conscientious about how you're actually choosing who you send the survey to, and also understanding that not everyone is going to give you responses. And so they're involved in the sampling, then the actual implementation of how you roll out that survey, what sort of mode you use, whether it's paper or with Vibrant, we have a digital platform or some combination. And then usually they're also involved in the analysis of the data that comes back. That's something that most of my survey methodology compatriots are actively involved in. At Vibrant, I'm really just involved in that beginning process. I'm there to help with the design of the survey and the survey questions themselves to really figure out how to get the best data possible for the folks that come to us with their research questions.
So I think that's a critical thing I want to explore is getting the best possible data, the quality, not just volume. Volume's important, but getting the quality data we need to really learn what we're trying to learn, answer questions that we're trying to answer in our area of scientific discovery. But before we even get there, which I definitely want to get there, how does one get into survey methodology? Because I think there's a lot of people out there building surveys, as I said, who have a scientific background in anything but surveys as the area that they studied and focused on, but they're doing that today. But how did you really get into this area of, should we call it psychology? Is that where it falls?
It is kind of psychology. I mean, I think it really is bringing in a lot of different disciplinary expertise. And it's sort of an all roads lead to Rome sort of situation. There are a lot of different ways that you can get into survey methodology. For me, my background is in political science. And so, what really sparked me and my interest was political polling and also surveys that looked at attitudes and opinions. So, that's where I really got my interest. And so, from there, it was really a natural pivot based on sort of my career trajectory. I wound up my first really stable job out of grad school. There were other jobs, but my first real stable job out of grad school was at a university where I was both a tenure track assistant professor of political science, and I also worked at a Center for Social and Behavioral Research where we were an applied research center. And so I was able to take a lot of what I had learned as a political scientist in understanding specifically, I was looking at environmental politics and policy, and I was looking at specifically the role of trust in these political situations. I was able to use that to pivot into really getting into the nitty gritty of what goes into making a good survey. What's a good study? Honestly, because most of my background was sort of more theoretical research. It wasn't applied, and so it was really the 2 years that I spent at that research center that I got fully into what the nitty-gritty is of designing a good survey, because
Hmm.
anyone can design a survey. Absolutely anyone. You can come up with questions and you will get answers. The thing is, will those answers actually answer the big questions that you're asking? And a lot of that you learn by doing, but a lot of that is also immersing yourself in a community of other people who are doing the same thing. And so there are wonderful professional organizations that I was able to be a part of that really gave me the skills, because it's psychology, it's statistics, it to some degree it's content. I've picked up a lot more in public health and other health research, just being a part of the beginning parts of the research where we're gathering data. And so it's bringing a lot of different areas of expertise together and learning how it all works together and learning how you get this comprehensive model of what's actually going to answer some really complicated and really nuanced questions.
Yeah. And something you said, I just want to hone in on this for a moment, because you said something about trust. And I can only imagine, especially in today's political environment, there is very little trust of the political part of our society on every side. But something I think researchers often forget is that there is an inherent mistrust of the health system, of healthcare providers to some degree, and by extension, health research. So, give me your thoughts on that, and what you've really seen in terms of parallels between the need to build trust in, um, you know, collecting data, polling for political reasons, and the need to build trust in the way that you approach data collection and health research. What parallels do you see there?
If we had all the time in the world, I don't think I could cover all of that. But I mean, the parallels are just so stark, um, because I think you see. I think COVID is the perfect example of why trust is so important, because you did see where the health system and the political system all of a sudden came together in a really confrontational way.
Mm.
And were able to see that because of the mistrust of the process, the mistrust of the products, the mistrust of the people who were talking and giving information, it's not surprising to someone like me who had really looked at that as an issue prior to COVID, because you saw this very starkly in the political system. And the thing is, with trust, it's really easy to lose it. It is 10 million times harder to gain it back.
Mm.
So once you lose it, you are going to be fighting an uphill battle the entire way. And particularly in a healthcare system where I think a lot of people see disparities, you see differences in how people are treated, and really how much people are listened to. And so what I hope to impart to researchers as much as possible is that transparency is so key. Yes, you can go in and ask questions, but you need to establish a foundation right from the start that says, I am here for these motives. I'm not gathering your data to sell your data. I'm not gathering your data so that I can use it in, nefarious ways or ways that are only going to profit myself. I am doing this. Exactly. Yeah, you don't want the evil genius in their volcano lair, that you want people to look at you and see you as a person who is asking these questions for very important reasons. And you hope that the altruism in the people that you're trying to reach will get them over that sort of that hump of okay, I'm going to take that first step because I think that this is for the best and this is going to be a greater good sort of situation. But sometimes you're not going to get there.
Mm.
And so you have to really put forth that effort that explains what are you going to be doing with people's information, because there's still a lot of clout when it comes to people who are individual doctors, individual researchers. It's the conundrum that we see where in politics people hate Congress but love their individual congressperson.
Yeah.
And so you have to capitalize on that individualized trust, and you have to do it in a way that is open and transparent, and you have to give some to get some.
Hmm.
If you're willing to give people some skin in the game of, even if it's just like compensation, say, we understand that we're asking you for a lot, so here's something in return. um it's finding ways to build that trust, because you have to rely on the goodness of people, and people have been burnt.
Yeah. And that's something I think is easy for researchers to forget, is that they are asking people to give them something. Often it's for free. Let's be frank. They can't, not all research programs can afford to compensate people for participation. Some can, some just can't. And instead of thinking about the participant first, I think, and often what we find is that researchers are creating undue burden on the participants without thinking about it. That's just one of the common mistakes I see. But I'm sure there's lots of others. And if we like really focus on data collection, because that is your business, if you will, that is your area of focus. I bet there's a lot of things you see over and over again in terms of common mistakes, common missteps, let's call them, in survey creation or design or data collection, period. trust building or failure to build trust. That's probably number one. What
Big,
else do you see?
huge.
What else do you see?
I think overburdening the individual is one of the big ones. And I get it. I have that research background. I know you want as much data as possible because sometimes you just don't know where that key point is going to be, what that key thing is that you need. And so, what I do sometimes see is that researchers are just kind of throwing spaghetti at the wall to see what sticks. And so you wind up with participants spending, an hour or more answering questions. And these can be really fine point invasive questions. They're asking about health history, they're asking about
Yeah.
reproductive history, they're asking about things that are very sensitive to individuals. And it's just question after question after question. And I think prioritizing is going to be step number one,
Mm.
because you need to understand that when a person comes into the survey, even if you say, yay, this might take 30 to 60 minutes, that doesn't really register of what sort of mental effort is going to be required for the next 30 to 60 minutes. And so there's a chance that they may get halfway through the survey and then never come back again. Even
Hmm.
if you send them reminders, even if you gently nudge them and say, hey, you haven't filled out the rest of your survey, they may never come back. So you need to prioritize so that at the very least, those important questions are at the front. And even better, see what can be left out. Because remember, this is not necessarily going to be your only time that you're able to communicate with this person. That's one of the great things about the Vibrant platform, is that once you've created an account within our platform, if that person then gives permission to be recontacted for other studies, for other surveys, you have the way to get in touch with them again. You have a way to capture their interest again. And so do not overburden your participant. That's also one of the big ones. Um, and I think, and I say this with all due respect, because so many researchers, they've been making their own surveys for years and years. They feel very confident in doing it. Please be aware of what you don't know and recognize that new eyes, even if it's not a survey methodologist, new eyes should be put on those questions to make sure that they are understandable for your target audience. Okay.
Don't we all need to follow that advice in so
Yes.
many ways?
Yes. And I will be the first to admit that I don't always take my own advice.
Mm.
I don't always get those
Don't
eyes.
don't admit that out loud. Don't
uh,
admit that on my podcast. But yeah, so that fresh eyes, having an addition, especially when you're going to a community that you are not a part of.
Exactly. That is so incredibly key. And I see so many researchers who, all the credit in the world, they are trying to bring in underserved populations.
Mhm.
And I think that is so important because research has really been done on white men. I mean, that's just the history of health research. And so it's so important to be broadening who is included in that research so that we can reach so many more people. And when that is not a community that you are necessarily a part of yourself, that is when it is absolutely crucial to bring in new eyes and new voices and say, ask them, does this make sense? Does this actually elicit the information that we're trying to get? Because we're talking about really complicated things that often require, medical jargon and long medical terms, and you need to be able to translate that into language that absolutely everyone can understand, because if you don't, you're going to get bad data, and bad
Well, and
data is the enemy.
and probably not enough data because you
No.
have you now are scaring people off. This doesn't make sense to me, and I don't have a medical degree, and this looks scary at this point, and so I can absolutely relate from my extended family and their familiarity and comfort with some of these terms. So, but what would you tell researchers? How do they go about engaging people, engaging those fresh eyes? I mean, first you have to have an ego check and be open to feedback. But what are some of the things you see succeeding with? Like, how do you reach out to that community? Let's talk specifics.
I think this is where we're really going to be reliant on local community contacts, and
Mm,
I know that's something that's very difficult, especially when we're talking about really broad research that's being done nationally. But whenever possible, you want to reach out to the people that you are intending
mhm,
to include. And sometimes that's something that you can do directly. Sometimes you need to find a colleague who maybe has contacts or maybe who is closer to the community than you are. But, ideally, in a perfect world, we reach out and we do testing before those questions are ever given to a broader audience. You want the people who are going to be experiencing that survey, you want them to be the ones who are reading through it and giving feedback.
mhm.
There are a number of ways to test that. You can have them simply take the survey and then do just a short interview to get their feedback. You can do what's called cognitive testing, where essentially it's a talk out loud exercise. They read through and they just go through what's going through their mind, and so they can say, well, you're asking about my the age at which I received this vaccine. I'm thinking back and I don't even remember that age. Maybe I think I vaguely remember going to a doctor and getting some shots, but I can't tell you how old I was. So you need that target population, whether that is an underserved minority, whether that is an age group.
Mhm.
We're not just targeting 18 to 35-year-olds. We're talking about people who are all ages. You need to reach out and touch your fellow human, and get feedback from the people that you were trying to reach in the first place.
Yeah.
And like I said, I know that's difficult, especially so many of us are working across the country. We're in remote situations, but I think all you can do is try, and you just need to put forth your best effort and get as close as you can.
Yeah, that's a great point. And something that just popped into my brain thinking about getting that feedback. Let's talk about translating surveys because we often need to collect data from populations that don't speak English, or they do speak English. I'm just thinking about Spanish speaking populations as a person raising bilingual children. I know there are a lot of concepts that do not translate one to one. There are things that you say in Spanish that absolutely make no sense in English and vice versa. And so, talk to me about translating and collecting surveys from two different language populations. Because if you're going to try to collect good, solid data, you cannot rely on things like Google Translate.
No, please do not rely on Google Translate for
No.
something like that. Um, no, that's an excellent question because I actually, as part of my doctoral research, I had to create a survey that was both in English and French because it was in Canada. And so I had to reach out to a native francophone essentially and go through the survey just basically line by line and go through and figure out, because so many terms, like you said, they just do not translate. And idioms are also just the bane of a translator's existence. And so once again, you need someone with that, I mean, for lack of a better term, local knowledge. You know, as researchers often have resources that they're able to use that are translation companies. Many of those are really great. They have native speakers who can go through and find also sort of the happy medium between different dialects
Mm-hmm.
of whether it be Spanish or French or what have you.
You would not believe how many ways there are to say popcorn in Spanish. Every country's got its own word.
Oh, I am in no way surprised. And which is why I have kind of given up at this point on ever truly learning a foreign language. I might be able to find my way on the subway, but that's about it. Um, because it is definitely, and this goes back again to knowing your target population. Um, if you are looking at, say, Mexican families who have immigrated into the United States, that's going to be a dialect that
Mm-hmm.
honestly, it may be different depending on what parts of Mexico they're from, but that's going to be different from, say, Costa Rica. That's going to be different from other South American countries. And so
Colombia.
you have to do whatever you can to find the most common denominator.
Mm-hmm.
And that is going to be very difficult. You're going to have to get very creative in how you explain things. Um, because, some of those medical terms, you have to really provide context in order to understand what those terms mean. And so it's a little bit of a minefield. Um, not gonna lie, but not to say don't do it, because it's so important to make sure that you're being accessible to as many people as you possibly can be. And so I would, and I feel that I've kind of rambled here a little bit, because this is one that I've struggled with myself in the best way
Mm.
to go about this. I think if you have the resources to do so, find a reputable translation company. If you do not have those resources, reach out to your colleagues, reach out to other departments at your institution or other divisions, and find someone who can work with you. You may not get it 100%, but if you can just provide as much context and as many different ways of explaining things as you possibly can, you're gonna get a lot closer than you would otherwise.
You're right. Because then what you're trying to do is ensure the data that you are collecting, regardless of language, regardless of participant,
Fits.
yeah, it fits,
Like,
it's
fits what it is that
valid,
you're looking for
it's
or
reliable
expecting.
data. Exactly what
Yes,
it's answering the question accurately for that participant. So
exactly.
let's think about that a little bit and explore that in general. So take the language translation out of it, and let's just focus on survey design. Validity, reliability, quality of data is volume may not even be number one. It might be valid quality data is the number one goal of data collection, and then volume probably very close second. But if we don't have good data and we don't have thorough, complete data, our survey is gonna is not valid. We cannot really do the research and the deep discovery we want to. So, what are some of the things that you typically are doing with our collaborators or have seen work to ensure that the data collection instrument is going to uh, yield that quality?
So there are a few things that we can do. One of the things that I always recommend, and I throw this term out all the time. It's so cliched, but don't reinvent the wheel. Don't do it. Um, if your research questions are related to something that has a large body of literature where other people have probably come up with some
Mhm.
sort of questions or maybe even scales that you can use to measure the concept that you're interested in. Use those. We have a number of them in our library here at Vibrance because there are certain concepts that are just so nuanced. You need that validated survey or that validated
Yeah.
scale to make sure that you're properly understanding the nuance. So the example I always use is if you're asking whether or not someone is depressed, or to what degree they're depressed, you're not
Mhm.
going to just ask them, "Hey, are you depressed?" That is something that is far too nuanced to be simply asking a direct question. So there are a number of questionnaires that you can use that will get at, okay, well, have you felt down lately? Do you feel like there's no hope? How often are you reaching out to friends and family? How often do you feel optimistic? It's getting at those multifaceted concepts in a number of ways so that you're able to use the entire package of questions and come out and have an idea of whether or not this person would qualify as clinically depressed, whether that be mild, moderate, severe. So use what is out there. Now, that's not to say that you can't adapt. I mean, there are some areas where you need to leave things as they are. Those scales, for instance,
Mm.
they have been tested, they have been scientifically tested to validate that they are actually giving you the information that you need. Now, there are other surveys out there where they will ask questions that we just know work.
Mhm.
You see these in a lot of the big surveys. So, Census Bureau questions, the American National Election Studies, the American Community Survey, and then you get into just all of the different health studies. All of Us is a great example
Yeah.
because there are a number of surveys that have been put together where questions have actually been taken from different sources and put into one package because those questions are worded in a way that are really, really good. They're well understood, and they give you the data that one would expect by asking those questions. So first and foremost, go out there and see what other people have done. Just save yourself time and energy.
Or come to us because we can show you
Or come to us.
some of those validated instruments, which my opinion, seeing the dozens and dozens of those instruments, you showed them to me the other day, and it's incredible the amount of information and questionnaires that we can reuse. Make a few changes if something isn't necessary, but being able to rely on what other scientists have successfully used, I see that as a great point. Are there other points, other things that you would recommend to make sure that data is quality?
Find yourself your friendly neighborhood survey methodologist.
Of
Um,
course, shameless plug.
shameless plug for all my compatriots out there in survey methodology. Um, no, I think this, and again, all due respect, people have been doing surveys for years and years, recognize that there is an entire body of literature that is out there to help you. Um, Maybe you don't need your survey methodologist. Maybe you just need the right resources. Go out there and figure out how to ask a good question.
Hmm.
There are great resources out there for just best practices. Things like the language that you should be using at what level. I think eighth grade level is typically right at kind of the sweet spot. um, how to ask just one question. Something that I see often is that uh, surveys will have what we call double barreled questions,
Mm.
where they're asking two things at the same time. Don't do that. Please don't do
Eesh.
that. Because then you can't work out what the responses actually mean. Um, there is what I would call sort of the survey, well, really the questionnaire design Bible, which is written by Don, I think it's Don Dillman. Dillman for sure is the last name. Um, that is where you can go for good questionnaire design. That is where you can go for good implementation for different modes, whether you're doing a paper survey, whether you're doing a phone survey, whether you're doing an online survey. There are resources out there, because if you can't do the very basics, then everything down the line is going to suffer.
Mm.
So please, please, please do your homework. Find those resources. They're out there. And ask me.
Yeah,
I'm a
right.
resource.
Yes, that's great. I'll again make sure everyone comes straight to you and your
Right to me.
colleagues and your peers.
That's right.
So, related to the quality question, what about? And I'm tiptoeing up to the question I really want to ask. Let's start with what about when people don't answer a question? They fail to respond to a specific question or maybe an entire survey. How do you, what do you recommend to people who say, we didn't make this a required question for a reason, or maybe we did, and what we see is people drop off. When there's a question, people are not answering. How do you deal with that? How do you recommend researchers rethink asking?
I think you have to then look at what is this question and what is it eliciting in your participant. What about it is causing them not to answer? And that can be a number of things. It could be a sensitive question.
Mm.
It could be one that they may look at and say, "That's none of your business." There's still quite a few people out there who don't want to answer questions about what their yearly family income is, because that's not something they share. Um, or is it poorly worded? Is it confusing? And so, you need to take a step back and figure out, okay, well, what is it about this question that's causing this issue? What I try to recommend too is, maybe this particular question is some sort of block for people, where
Mm.
now you're losing out and they're just going to say, you know, never mind, I'm not doing this. Always give people an out. Make it required, but make one of the response options prefer not to answer,
Hmm.
because then okay, they just don't want to answer this question, and then hopefully they'll continue on, and you'll still get some good data from that individual. But yeah, you definitely need to take a step back and ask yourself, what is it about this question that is causing such consternation?
And the question I want to ask, which is related to that. Why? Why do participants, and I've been coached not to ask it this way. Why do participants lie, or why would participants lie? So I'm going to ask it differently. That's what I want to ask. But the question that I've been curious about for so long, and I have my own personal opinions, but why would participants provide maybe an inaccurate answer on a survey? And how can we prevent that in the way we design a questionnaire or the questions on the questionnaire?
Right. So thinking about this, usually I say there are two different kind of ways that could go. I actually think there might be a third way. So, one of the general concerns when it comes to surveys that we don't see as much at Vibrant, simply because of how our format is situated, but sometimes you get survey trolls
Mm.
or bots. You get people who are intentionally providing bad data, just to provide bad data.
Who has the
Um,
time?
and it's funny because I remember going to a conference a few years ago, and someone presented on, they had found they were trying to work on machine learning to
Mm.
identify these fraudulent responses, and so it's an ongoing uh, resolution. But it's a problem, and especially when they're opt-in surveys. So if you're on a panel for one of the big survey or polling companies nationally, or if you're able to navigate to a survey without having a special code to get in, you have people who they just like messing with you, and that's just sort of that's the internet age. um, so unfortunately, there's still no tried and true method
Mm.
of dealing with those. That is an ongoing issue. I hope maybe in a few years I will have something to report back. Um, One other thing that I think it comes down to is, so actually this is kind of a two-parter. Either someone doesn't know the correct answer, and so either they're not giving you an answer at all, or they're giving you their best guess, um, or they're interpreting the question in a way that you don't intend them to.
Mm.
So in that first one, I've noticed that there's a quite a bit of a generational gap in terms of what people are comfortable sharing regarding their own health issues, and what then trickles down to their family members. So when I'm asked to fill out a family medical history, there are some things that I just can't answer because I don't know. I may know that someone had this surgery for one reason or another, but I don't know what that reason was. I just know that there was a surgery, and it's because that comes from a generation where you just don't talk about that stuff. Um, or for some reason they're ashamed to admit, maybe if you're asking about something that's sensitive, like maybe
Hmm.
STIs, or if you're asking about something that's emotionally difficult, like miscarriages. Those are things that people either they don't want to admit the information, or they're not in a place where they can be open and honest about it, which means either they give inaccurate information or they just disappear entirely. And then lastly, I would say that it may be an issue of you're asking the wrong question, or you've asked a question that is worded in a way that has multiple interpretations. And so this goes back to have multiple eyes on your questions, because maybe you're asking something in a way that they think they're giving you an accurate answer, but ultimately that's not quite what you meant. So I would say thankfully the trolls are typically a smaller concern, particularly with Vibrant and our partners. We don't have to worry about that because it's really difficult to get in there and be a troll. But I'd say the other two are still issues. And when it comes to some of the sensitive information, that's where trust is very important.
Hmm.
Um, and understanding your population, understanding your audience, that's very important.
Right.
And ultimately making sure that you're asking clear and appropriate questions for what it is you're trying to get out of it.
Yeah, that's great feedback. So here's a question I've heard come up a couple of times with studies I've been working with, and that is, either our e-consent or our surveys have to change. Maybe they're changing frequently, or they change over time. And as a survey scientist, essentially, the importance of keeping data unbiased and keeping questionnaires consistent over the course of a population. Or reaching out to a population, I should say. How do you manage it when changes have to be made?
You just have to be very clear on what is changing and why. And there's, it's a little easier on the front end. Maybe a question needs to be changed in, if we're talking about the Vibrant system, question needs to be changed. I make that change. I send it to our configuration team. There's some testing. Boom, we have a change. But you have to also consider what then happens on the back end, because every change changes your entire questionnaire is ultimately what happens, even if it's a small change. If you change the wording of a question that's already gone live and you have participants who have answered it, you have to have an asterisk essentially when you are analyzing that question, because you have just changed the conditions under which that person is answering these questions. Because it's not just that one data point that changes. Every change you make has downstream changes. You've completed, I mean, it's like making a change during a controlled trial. You If you make a change, you're no longer doing the same study. It's different. And you have to be very transparent about that. And you have to be very careful about how you're managing your data. If you're adding a question, then you can, split your data set into two and say, this is what we saw before we added that question. This is what we saw after we added that question. But you have to make that distinction. You have to be very intentional and you have to be very transparent when you are sharing your results. You cannot treat them like they're apples to apples. You now have apples and oranges. So I don't say that to dissuade changes, because I know sometimes they do have to happen. If you have, one of those questions that you mentioned where people aren't answering and they're breaking off and they're not finishing the survey, okay, you need to figure out what is going on with that question. You have to be intentional about what it is that you're doing. But be very, very careful. Don't a little change here and a little change there, those add up, and they impact your entire questionnaire. So be very, very mindful of what you're doing. Be very careful about how you're treating that data after the fact, because you have to understand that every change you make, you're changing the entire condition. And I don't think that's readily understood by a lot of researchers. And I always caution every time there's a change, are you sure?
Do we need to make the change?
Yes, because that's, and I know it has to happen sometimes, but then you have to treat the data differently.
Yeah, great feedback. So there are a myriad of tools and ways to administer questionnaires and surveys today. Before we get to kind of our last forward-looking question, I'm just wondering, you've referenced, obviously we work together at Vibrant. You've also likely used REDCap and a lot of other survey tools out there, Qualtrics, there's tons. So how would you, knowing what you know today, recommend researchers look at the trade-offs across different survey tools, data collection tools or platforms? What do they need to be considering as they are making a decision of how to administer surveys?
Sure. So, I think the sort of front runner in most researchers' mind is going to be cost.
Of course.
Which obviously we all absolutely understand. Resources are limited. You're fighting for grants, and you can't always just pull out the personal checkbook. And so there are lots of options out there. Qualtrics obviously has different tiers. There are others that I've worked on that it's the same thing. Even SurveyMonkey, you can have the free account, you have the basic account, etc. And each of those comes with different advantages, different trade-offs. REDCap, obviously very popular because you just need an institutional license. But it's free. It's not something that researchers have to pay for. And all of them have, their advantages in terms of being relatively user friendly. You're able to use a number of different question formats. You have the option of either sort of point and click and drag and drop, or you can, do some very light coding to get things the way you want. So I think ultimately what researchers have to decide is what aspect of those platforms do they actually need and will they actually use? So one of the things that I found with Qualtrics in my own personal research is that their higher tiered options, they give you a lot of tools that you can use on the back end. So when it comes to running reports, when it comes to analyzing data for, some sort of like comparative insight type of things, they give you a lot of tools. But when I was doing my own personal research and in some collaborations that I've had, that's a different sort of ballpark than what the researcher who's actually creating the survey is going to be using. Typically, you see people working with statisticians, with other methodologists who are going to be doing that work for you, and in a way that's very particular to your domain. Because the thing with all of these different services, Qualtrics, RedCap, what have you, is they're trying to be all things to all people. They're trying to reach as broad of an audience as they possibly can. And so their main impetus is to make it easy for everyone and not to create tools that are specific to what you're going to be using the platform for. So, as someone who has a lot of experience in developing surveys, I find a lot of these platforms to be very frustrating because there are things that simply don't make sense from a survey methodology point of view. And again, this is going to be another shameless plug. That's why I'm very happy to be doing the work that I'm doing at Vibrant, because we do have our own platform that I get to work in that allows us to really pivot depending on what our collaborators' needs are. And I get to bring in my expertise to help with that. And so, obviously, you have to figure out how you're going to use your resources. You have to figure out what tools are important to you. And I would start with that and then go out and look at the different platforms to see who has what it is you need, but always understanding that these are tools that are not made specifically for your specific research. These are general tools.
Yeah, good feedback. All right, last question. What, if any, are the emerging trends or emerging challenges that you see in survey methodology? Where is the field going to be going?
Oh my goodness. Put on my fortune teller's hat here a little bit.
Break out the
There are
crystal
things
ball.
that there are things that I think we're always experiencing new challenges. And I think we're always having to kind of meet those challenges where they are. And a lot of that comes from just how many different ways that people are designing questionnaires and what it is they're trying to do with it in terms of research. Um, and honestly, I think one of the biggest challenges that we're going to be facing for a while is really combating, I think to a large degree, perception of what surveys can do and what surveys can actually tell us. And I saw this quite a bit with political polling. You ask one question in a certain way, and you get this headline in one particular newspaper or news site. Excuse me, I'm showing my age. Newspaper. And
Well,
then you
they still
you know
make them. They still
they
make
do still
paper.
exist. They do still exist. And then you see a slightly different worded question from another source that creates a completely different headline. Ostensibly, these are asking the same question, but with two very different results.
Mm.
And so I think educating people is just the constant challenge that we are coming across. Particularly after 2016, when the headlines were "the polls are all wrong."
Oh.
Well, there
Were they?
were they? And so, that's just the continuing challenge. I think that is always a discussion that I'm seeing amongst other folks who design and implement surveys and questionnaires. I think we're also always trying to figure out how to reach the people we're trying to reach. Mobile technology has been huge for being able to provide accessibility. A lot of people, even if they don't have internet at home, they have a smartphone. That is their connection to the world. That is
Mm-hmm.
their way of applying for jobs. That's their way of getting their medical records. That is their lifeline. And now we can give them an app. We can give them a mobile responsive survey on their web browser. But that has made surveys so much more technical. It's an art and a science, and now we're having to bring in some IT to support both of them. And so I think it's going to be constantly evolving, and we're going to constantly be looking for, how can we make things better? How can we make things more accessible? And these are conversations that are just going to continue on. I don't think there's ever going to be sort of an end point where we get to stop and celebrate, but that's the fun part of what I do is I see new challenges with every partner we bring in, and it's always a big puzzle for me to figure out, and that's one of the fun parts of being a survey methodologist. The thing that nobody truly understands what
Yeah.
it is I do. I tell them, just trust me, it's fun.
Well, and after getting to know you these last couple of years, I just can't look at any question anyone ever asks me the same way. I'm always wondering, did you intend to get the answer I'm about to give you?
A job well done.
Right. Yes, you have changed the way I think about asking questions as well. Well, thank you so much for joining me, Megan. I, of course, selfishly loved having this chance to pick your brain. I am so in admiration of the work you're doing with our collaborators. So many of the research programs that we work on need and value your expertise. So I'm very grateful for that and for the time you spent with us today. So thank you again.
Absolutely. My pleasure as always. I'm thrilled to be able to bring surveys to the world.
Awesome. Thanks so much for listening to the People of Precision Health podcast. To join us next time, subscribe wherever you get your podcasts. And to learn more about how we're helping to engage the humans behind the data, visit vibranthealth.com.